So my name is Shelby Lopez. I am currently a student at Eastern Kentucky University. I am pursuing a degree in psychiatric mental health nurse practitioner, and I plan to practice in Texas. So today I'm going to be discussing the issue of health economics and how it can affect the advanced practice nurse in the primary care setting. So the first question you might have is, what is health economics and how can this impact us as future advanced practice nurses? So health economics is a blueprint of statistical analysis. It's evidence-based and it's the most concise and direct form of treatment. It acts as a framework for the prescriber when prescribing, and it guarantees that there is a payout from the insurance companies as well as a minimal cost for the patient. And also it includes the facility fees so that they also get reimbursed as well for usage. So it acts as a checks and balance system for the prescriber who is prescribing to guarantee that whatever they're prescribing will be covered and that there is not an overabundance of unnecessary prescribing or treatment modalities. According to Johns Hopkins Bloomberg School of Public Health, the health economics are theories of production efficiency, disparities, competition, and regulation to better inform the public and private sector on the most efficient, cost-effective, and equitable course of action. So again, to just reiterate, it's the most cost-effective form of treatment that pretty much guarantees that an insurance company will be able to or agree to pay. So benefits to this are, as a future prescriber, you know that what you're prescribing will most likely be covered, that it'll be at a minimal expense to the patients. It also guarantees that the facilities or diagnostic prescribing that you're doing will be available for your patients because there is an agreement with how much will be covered. So a challenge to this would be, what if the most cost-effective form of treatment for prescribing was not beneficial to your patient? So what if the medication maybe gave them an adverse reaction in the past? Or perhaps you had further questions that you wanted to explore with what the patient was presenting with, and it went against health economics. How would this impact your prescribing and your treatment to your patient? Would this hinder maybe their progress based off of the health economics and the structure that would be potentially prohibiting you from further exploration with what your patient is presenting with? So that would be one consideration as a challenge, that you don't know if something that you felt would best benefit your patient would be able to prescribe or potentially kind of get shut down. So I have the suggested plan that I have come up with, especially when working with specific demographics, regions, things of that nature, is what you're prescribing the most cost effective. If it is, we need to make sure that each population that you're serving is able to obtain it, such as the rural population. Would it be ethically okay to prescribe a medication that required weekly labs if your patients lived 75 miles from the nearest, facility that could do blood work? So you have to make sure what you're prescribing is obtainable financially, distance, take into consideration all outliers that could affect your patient's care, as well as, their continuum of care, with a guarantee that they would be taking their medication to maintain their stabilization. So a proposed resolution by the psychiatric mental health nurse practitioner to consider when practicing would be to make sure that what you're prescribing is the most cost effective with your patient's interest at the center of the care. Would this best benefit the patient in all realms? Additionally, is there evidence-based practice to support what you're prescribing? Can you justify ordering something or prescribing something that's more expensive if you had to advocate for it with an insurance company or a facility if they were denying your order or your prescribing methods? Also, again, just to reiterate, the socioeconomic status of the population that you're working with. If you're working with an indigent population in the behavioral health setting, you want to make sure that the medication you're prescribing is truly obtainable for those patients to be able to get. And we already touched kind of on the rural population and making sure that the form of treatment that you're prescribing is something that truly is obtainable for them. Okay, so I have two questions that I came up with today for further discussion. Question number one is, at what point does the advanced practice nurse consider that a medication or prescribed treatment modality, even if it's in the best interests of the patient, is truly unfeasible? So at what point do you know, like, hey, this medication would benefit my patient in every realm, but there is no way that they can obtain it? So where do you draw the line with let's go ahead and prescribe it or let's not? So do you want to go with a more generic route that might help the patient as opposed to something that you know would best benefit them? How do you know as a prescriber when to draw that line? Okay, and question number two, I thought this was kind of would help us in the future, would be what community resources are available to alleviate the financial burden of these more cost expensive or costly medications. So are there contracts with the county that you live in, or what about the local pharmacy? Do they have some form of like discount card or local grocery store? How can these patients obtain their medications so that you as a prescriber know that they're maintaining their stabilization? So those were the two questions for further discussion. And then in conclusion, it's imperative that the advanced practice nurse be knowledgeable of all evidence-based research that's going on to support their modalities and prescribing. They need to be considerate of the out-of-pocket expenses to the population that they're serving, and make sure that they're prescribing ethically so that they know that their patients are getting the help that they need. Might have to advocate for your patients with insurance companies or the facilities to make sure that what they're needing or what you're thinking that they need can be obtained. And then lastly, this is just information for us to consider in the future with practice. This might be a limitation to our autonomy that, prohibits us from prescribing, what we think would be in the best interest of our patients. So I thank you for your time today and our discussion and presentation of health economic issues in the primary care setting that could affect future practice. Thank you. Bye-bye.